So TAVI is short for transcatheter aortic valve implantation. And basically it's a minimally invasive way of changing your aortic valve. Your aortic valve is the last doorway out of the heart, and when the heart pumps, the door opens and then it closes. Commonly as you get older, this can get hardened and calcified and then stenosed, and that means that it doesn't open as freely. When it doesn't open as freely, the heart struggles, and so it puts strain on the heart and ultimately could cause heart failure. And we have degrees of the stiffening of the valve, and it can be mild, moderate, severe. But when it gets in the severe range, we think it's better that that is changed so that the heart does not struggle and it functions well. And the TAVI procedure was developed over the last 20 years, and usually when we do a procedure that's straightforward, I can do it within 30 minutes, and the patient is then back on the ward within an hour or so. What are the advantages? Well, you don't have a general anaesthetic, you're not in hospital for 5 to 7 days post-open heart surgery, and you don't need intensive care. Although it can be done as a day case, it's generally done as an overnight stay. So you come in the morning of the procedure, everything's prepared in terms of backup blood measurements and pre-assessment. After a few hours, you will come to the lab, and it's a cath lab theatre environment, very sterile with the operator, the nurses, people looking at the blood pressure all the time, people controlling the x-rays which help guide us how to do the procedure. And the way the procedure is done is you have an access point in your wrist, which is called the radial artery, and we put a little tube in there and pass a tube up to the valve, and that helps take pictures and show us what we're doing. And then the main procedure is done by the top of the groin, and you have larger blood vessels, arteries there, called the femoral arteries, and we puncture them with a little needle, and it's called a Seldinger technique, where you then pass a wire and then a tube over the wire, and then you're in the blood vessel without having to open up or cut down on anything. Through that little tube, we make that tube gradually bigger, so big enough to pass a valve. The valve itself is usually crimped down, so although the valve size might be like this, when we're putting it into the body, it's down like this, a bit like a spring of a pen. And then what happens is there's two types of valve. One has a balloon in it that you expand the balloon, which stretches the spring or the valve, and then that puts it in place. Then you release the balloon, the valve stays, and you remove the balloon. Another one doesn't have a balloon, but it expands by itself. So as you retract the cover of the valve, it starts to open, and then it opens up and puts in place. So there's two types of valve. And depending on patient's anatomy and what we think is the best for them, we choose which type of valve to put in. Now, if you ask what are the risks for this procedure, so the risks are relatively low. So the risk of death is 1% or lower. The risk of having a stroke is about 2%. The risk of needing a pacemaker is about 10 to 15%. Our rates are about 8% or lower. The reason is where the valve is situated, the control center for the electricity of the heart that makes the heart beat is quite close. And so when you expand the valve, and what you're actually doing is pushing the leaflets that are there already to the sides, you put some pressure on the control center, and then the heart rate can slow down. And we only really know whether that happens after the procedure. You have one-to-one care with the nurses who monitor you. We have the intensive care team if we need the intensive care team, but rarely do we need that. And afterwards, the day after, you can get an echo to show that the valve's working well, and we make sure you're walking, eating, feeling happy, and go home. And one of the advantages of Nuffield is the excellent cardiac rehabilitation facilities we have, which will enable you to get back to full activity as quickly as possible.